In December of 2007, the future that I saw unfolding was becoming bedridden by my illness, possibly demented by my illness, and possibly dying with intractable pain such that I would be unable to communicate. So, somewhat grim future. I redesigned my diet. I'm taking my supplements. I'm doing my electrical stimulation of muscles. And what is shocking is how quickly things begin to change.
Well, hello, everybody. Welcome back to a little time working on our mental health, working on our mental fitness, making sure every day we're doing something to take better care of ourselves and reminding ourselves we are not alone in this journey to optimize our mental health, improve our mental fitness. Today, we are going to be talking with a just beloved member of the wellness and functional medicine community, Dr. Terry Wahls. Dr. Wahls is known for her Wahls Protocol, and we're going to talk all about this. She's a functional medicine certified practitioner. She's been conducting clinical research trials around multiple sclerosis, which she was diagnosed with many, many years ago. She's been very open about her fight with that illness and all of her success. She's been awarded the functional medicine is really one of the most prestigious awards, the Linus Pauling Award, which is for her research, her extensive clinical care. She has dedicated much of her career to caring for our veterans at the VA system. And most recently, she's the author of the Wahls Protocol. It's a radical new way to treat all chronic autoimmune conditions using paleo principles. And she also has a cookbook, because part of the reason Terry and I are so connected and Terry is here is just her love of food as medicine, her really walking the talk of those principles. So her cookbook is the Wahls Protocol, Cooking for Life. You can learn more about her current study on the efficacy of diet on quality of life and multiple sclerosis, and all about her work at terrywahls.com. And you can also, we've got lots of links in her show notes. Dr. Wahls, Terry, welcome to the podcast. It's such a treat to be with you.
Hey, Drew, thanks for having me.
We have been in this wellness world together for over a decade now, and you've been a real inspiration to me, especially in how upfront you are in talking about your mental health, talking about the active stance. And so I wanted to start, I gave a brief bio, but I wanted everyone to hear a little bit about your story from you and how this started.
In 2000, out walking half mile from home, my left leg grows weak and dragging it. I hobble home. When I go see the neurologist, he tells me this could be bad or really, really bad. And so for the next 3 weeks, I'm going through the workups. And at that time, Drew, I'm thinking about the fact I've had already 20 years of worsening trigeminal neuralgia. So I know what I probably have is a progressive illness. And actually, I'm praying for a rapidly fatal diagnosis because I don't want to be disabled. And 3 weeks later, I hear multiple sclerosis. I do my research. I find the best MS center in the country, see their best physician, take the newest drugs. And 3 years later, I'm in a tilt recline wheelchair. So I'm age 48. My son is 11. My daughter is 8. I take mitoxantrone, a form of chemotherapy, doesn't help. I take Tysabri, the new biologic, doesn't help. Then I'm switched to Cellcept. And that's when I'm asking myself, am I doing all that I can? So I go back to reading the basic science. And I'm not a PhD, so this is really tough sledding for me, going through all this basic science.
We skipped over. Will you tell everyone just about your training? Because you're just not, the average person who starts having some neurological symptoms.
Yeah, I'm an internal medicine doc, and I'm a physician, and I should also say I really believed in the uh, randomized controlled trials, new pharmaceuticals, new devices. Deeply skeptical of functional medicine, integrative medicine, and so when I was diagnosed, I treated my disease very, very aggressively.
It reminds me of so many folks who are listening or will watch this who've done everything according to evidence-based protocols, or done a lot to take care of their depression or anxiety, and they still have a lot of symptoms. Or so many, and I hate how we call it treatment resistant. As I've said on the podcast, where I've not met a lot of people who are resistant to treatments that make them feel a lot better from their symptoms and don't have side effects. I mean, that is what we all hope for. And so many individuals, I think, are in your situation where not that conventional medicine is awful or evil, but that it doesn't fix everything, or it
It doesn't
doesn't.
fix everything. We have these new drugs, Tizabri being one of them, that do a great job of turning off the inflammation, the new enhancing lesions. But see, at that point, I wasn't really having relapses. I was having progression. And so typically that's brain atrophy, spinal cord atrophy, and accumulated disability. And so I'm in a tilt recline wheelchair. It's getting harder and harder to sit up. I'm having more and more pain. And I think I'd mentioned to you earlier that I'd had struggled with depression since I was an adolescent. And that was continuing to be a worrisome problem. But I also, ever since I was an adolescent, recognized that there's always something I could be doing in between every event of my life and my response. There's a little space, and in that space, I can ask myself, what could I do to make the circumstances a little bit better? And so my response was, well, I could read. And so I started reading, the articles, and I decided that mitochondria were not working very well. That's what leads to progressive disability in MS and the brain atrophy, the spinal cord atrophy. So then I looked for research that would guide how I could create a supplement cocktail for my mitochondria. I figured out that I felt a little less fatigued if I took my supplement cocktail. So I'm pretty excited about that. And I'm reading more and more. And then I discovered a study using electrical stimulation of muscles in people who are paralyzed, and convinced my physical therapist to give me a test session. Hurts like hell, by the way. But when it's over, I feel great. It's very clear it has done something for my mood. And so we add the electrical stimulation, which I ramp up to as much pain as I can tolerate during the 20 minutes that I'm doing my e-stim. But I really like it because it does so much good stuff for my mood. I mean, really noticeably good stuff for my mood. And then I
Curious, there
discovered
research
the
around
Institute
that
for
the muscles contracting. I know we've put a little bit of content up about myokines. It's not just endorphins,
Yeah,
but there are
no.
these molecules. Does the electrical stimulation, is that part of your theory of how it, in
Yes,
this state where
so
you
it
weren't
makes
able
the
to move?
myokines. It makes the myokines because it really amps. I was able to do a little more exercise because of that. And we also now know if you do electrical stimulation while you're exercising, you also make more nerve growth factors in your brain and more endorphins. And so my brain loves electricity. Even though I can even jog now, I still do an hour or two of electricity every day because my brain loves electricity. It I feel so much. I mean, I can appreciate the cognitive and mood enhancing attributes of electricity. So I still dial up to as much pain as I feel like I want to tolerate at that moment because I feel so great afterwards.
Thanks so much, by the way, for sharing that you struggled with depression as an adolescent. And part of me wants to go to this moment where you're an individual with depression, kind of right before your diagnosis. What are you doing to manage your depression? And part of me wants to go to your adolescent history and just hear about what that was like and what tips you can kind of offer all of us who are interacting with adolescents as they're struggling with their mood. Well, can we do the first question first? How are things right before you diagnosed? Like, how are you taking care of your depression?
Exercising. What I figured out as a young adult going off to college that I needed to keep physically. So I had to do a lot of work on the farm. So I was physically very active, and I went to college and realized I had to maintain that physical activity. So then I got into long distance running. I got into taekwondo, and so doing taekwondo is like doing a hit exercise for the hour of class. So it's a very physically active. Still had when I had my kids, I was still physically active. I was biking, hiking, but interestingly enough, Drew, what I could do was steadily going downhill, and I was getting really annoyed with myself. I was working out every day because I got up at 5:30. I was doing my Nordic track and doing some mat exercises, but I was getting annoyed with myself that I kept being able to do less and less and less. And so when I was diagnosed, I found it's like I could forgive myself, like, okay, I wasn't being a slug after all. It was the development of this neurologic problem, which is why my physical fitness had taken such a nosedive in the previous year.
How did you manage the emotional aftermath of being a physician and getting diagnosed with,
Oh man, it was very upsetting. And I like many physicians, I go to the literature, look at that, and I see this is a progressive illness despite treatment. That within 7 years of diagnosis, most people are unable to work. I'm the main breadwinner for my family, and I'm like, oh my god, I, am I going to become a financial burden to my family? Very upsetting, and actually, my wife convinced me to stop reading the research. Said, Terry, this is just getting you upset. You have to promise you're going to stop reading. We'll find the best MS center in the country. We'll go there. Let them take care of you. So I did that for 3 years, and then when I got in the wheelchair, I thought, well, I know how bad it's going to be. Terrible. I'm going back to reading. I got to, what can I be doing? I could be reading and thinking deeply. Are there other things that I could be doing? And I also came to appreciate that when I made the decision that I would see the best person, let them take care of me, I was heading down learned helplessness because I was no longer as focused on what I could be doing. I was letting someone else make all the decisions. And when I went back to like, okay, I'll still follow my physician's advice, but I need to go back to what could I be doing and be sure that I was doing it.
this is such like an important aspect of our journeys that everyone needs to think about. We all do this. I do this. That's kind of like I don't know, this of a fantasy we have of expert caregivers who are really going to know. And of course, there are expert caregivers who do know a lot and can guide us and help us in our decision making and make recommendations and diagnoses. But that can often be a really disempowering process because it starts from an aspect that you don't know. And so Terry, such a good point for all of us that I remind my patients all the time of all the things they do know about their illness, about how to care for themselves, about what happened last time they got into an acute phase of the illness and how they got out of it. All the things that they do know. It's really um, staying empowered, self-empowered is
You
just
have
such
to be
a
sure that you're
key.
asking yourself, am I doing all that I can? Am I paying attention to, as you say, what seems to make things worse? What are the factors that seem to make things better? And how can I learn from when things are getting better and when things are getting worse? I teach my patients that, you know, you can keep a little journal into the detail that makes sense for you. So when you have a a a day of worse anxiety or worse depression, look back in the previous 24 to 48 hours, and do you have any theories as to what led to having a really great day or a really bad day? And could you avoid that if it was a bad day? And could you do more of that if it was a good day? And if you will just make that learning part of your experience over time, you can refine your self care to be better attuned with what your brain, your heart, and your body needs.
And mental fitness is one of the key tenets. We talk about self-awareness, and it's right up in the front of the book and the course. Because when I've been working with patients and thinking about it, how do we heal the brain in this modern context? This aspect of self-awareness is just so critical. If we're worried about being horribly sad and depressed after we've been maybe going a little too hard on the weekend and drinking too much or eating too much or not sleeping well, it shouldn't be such a mystery to us. We really have an awareness that moods, not always, but often come from places, stem or kind of evolve or grow from our circumstances, and being reflective on those is just absolutely essential part of mental fitness and taking care of your mental health. Terry, you start to get interested in food. You aggressively go through a conventional medicine protocol. You're very disabled. You're in your late 40s. When you're doing a lot of research, when does food start to really? I mean, how are you eating before this? My hunch is you're already healthy. Grew up on a
Yeah.
farm, healthy eater. How are you eating, and
So,
what
I grew up on the
changed?
farm, and then as part of the adolescent rebellion, I became a vegetarian. And my parents told me that, "Terry, you need meat. You are wrecking your health." And that just made me dig my heels in more. So then I go to medical school, and I learned that fat is the demon. And so I do a low-fat vegetarian diet.
Same with me. Terry, it's fascinating the parallels in our story. I mean, I also went to medical school. I went on a low-fat vegetarian
Yeah,
diet for about a decade.
and that was, like, really heart healthy, great diet, plenty of vegetables, rice, beans, a lot of, whole wheat bread. I made my own bread. I also, made, some cheeses, as well. And, I'm diagnosed with MS, and in 2000, the only diet in the lay press was the swank diet, another low-fat diet, so I could do that as a vegetarian. And interestingly enough, my neurologist at this MS center introduced me to the work of Ashton Embry, Direct MS Charity, who was a big fan of Lauren Cordain and the paleo diet. So I got his books, looked at his website, read his papers, and after a lot of prayer and meditation, I went back to eating meat. It took me several months to get the meat back in my diet.
Was there, so often with meat, we focus on, the cholesterol and the fat and the health consequences. And I think for a lot of us who are vegetarian, it wasn't just entirely about that. Can you
No,
tell us a little bit
no,
about the process of going to eat meat and kind of, it feels like you're speaking a little bit of the very personal and ethical and even spiritual elements.
you know what? I was very fond of my all of my animal companions on the farm. I didn't like eating them, and so I decided that no, I don't need to eat meat, and it'll be fine. And then when I decided, okay, well maybe I do need to eat meat, and uh, the circle of life. Uh, we are all consuming other forms of life because we aren't we aren't plants. We can't photosynthesize. We have to consume other forms of life in order to live. And so that allowed me to feel okay about beginning that transition to eating meat. And that took me several months, by the way. It had to reintroduce being able to eat and properly digest the meat. But I continued to go downhill. And I got more healthy fats into my diet. But I figured, well, who knows how long it takes to rebuild your brain and your spinal cord? It might take several years because I think it's about a 7-year turnaround for the tissues in your brain in terms of the repair process. It's like, okay, but at least I'm doing something. And it was my perception that when I went back to eating meat, the speed of my decline slowed. So that let me feel positive, and I'm adding the supplements. The speed of my decline slows. I can tell I'm feeling a little bit better on the days I take my supplements than not. And then when I had this big aha, and Drew, I laugh how long it took to have this aha. Um, so I've been doing the paleo diet for 5 years. I've been doing the supplements for 4 years. I discovered the Institute for Functional Medicine, and I have a longer list of supplements. And then, and I Oh, I think it's about 6 months after that. Well, 4 months after that, I have this aha. Like, what if I redesign my paleo diet based on the list of supplements that I'm taking, and figure out where those nutrients are in the food supply? So that's a few more months of research. And that at the Linus Pauling Institute of Micronutrients was very helpful. So I start that new way of eating in December 26, 2007. Now, at that time, I'm so weak I cannot sit up. I'm in a zero gravity chair. I have one at work, one at home, with my knees higher than my nose. I can take a couple steps with 2 walking sticks. I'm beginning to have brain fog, and I have trigeminal neuralgia, which has been getting relentlessly worse and more difficult to control.
And everybody, trigeminal neuralgia is this exquisitely painful inflammation of a cranial nerve of the face. And so it just, I mean, patients describe it as just searing nerve pain.
It's an electrical jolt of pain. It's like a cattle prod being pressed into your temple and a jolt of electricity going down across your face. It's at its worst when I move my tongue, it triggers the pain. So I'm not swallowing, I'm not talking. Attempts to speak result in the jolt of pain, so I'm unable to communicate. So, in December of 2007, the future that I saw unfolding was becoming bedridden by my illness, possibly demented by my illness, and possibly dying with intractable pain such that I would be unable to communicate. So, a somewhat grim future.
Well, Grim, and on top of, you said, having struggled with depression, and when I asked, how are you coping, you said exercise. Well, you're now in a setting where your number one coping tool is not
Had
possible.
been removed, yeah. Well, it's probably why the electrical stimulation, which I discovered, in July that summer, was so helpful for my mood because I couldn't really exercise, but I could do the electrical current, do a little bit of exercise. The electrical current would give me more intense exercise equivalent, and it really helped my brain. It helped my mood immensely. And of course, with such a grim future and a history of depression, you might think like, okay, surely you must have thought about deciding that this was too difficult to go on. But I have two young kids who are watching me, so it's like, okay, I have to do my little tiny workouts, go to work, stay positive because I know my kids will face difficult times in the future, and I need them to know that life's difficult, but you do the best you can anyway, and you don't give up. So it was very helpful that I had my 2 kids, that my mantra in the morning was, "They're watching you. You gotta do the best you can, so they will do the best they can." So anyway, I redesigned my diet. I'm taking my supplements, I'm doing my electrical stimulation of muscles, and what is shocking, Drew, shocking is how quickly things begin to change. In the next month, my brain fog is definitely less. My mental clarity, much better. My energy is improving. My physical therapist says, Terry, you're definitely stronger. Let's have you do your exercises 10 minutes twice a day. And then it's 15 minutes twice a day, and then 20 minutes twice a day, then 30 minutes twice a day. And then, I think the end of February, so 2 months into this, I start walking in the hospital with 2 walking sticks, stunning my colleagues and me, frankly. And then with 1 walking stick, then with no walking sticks.
How do your colleagues in conventional medicine understand this? I mean, as you
Well,
say,
they all think it's because I'm on Tysabri, and I said, "Oh no, I'm not on any Tysabri. I'm on Cellcept," and I whip out my portable eStim device. I talk with them about that, and then it's very interesting. I every 2 years you meet with the chair of medicine to review what you're doing, and it was time for me to go meet Dr. Rothman. And I walk into his office, and he hasn't seen me in about 9 months. He's like, "Oh my God, Terry, you're walking." So yeah, I tell him what's going on. He's a rheumatologist, so he appreciates how remarkable it is that I'm walking. And in the end, he wants me to write a case report along with my treating medical team about my case, which I do. And then he wants me to begin doing clinical trials, testing if others with progressive MS can do this complicated intervention and what happens. And he helps me launch my career doing clinical trials.
Reminds me of when the SMILES trial for the Mediterranean diet intervention in depression came out. One of the findings was that patients with depression can modify their diet, which sounds quite infantilizing, but it was a question. Right? You have illness that saps motivation, energy, creates some cognitive fog for many patients, can contribute to feeling overwhelmed and pessimistic. That's not a great mindset to suddenly learn a whole bunch of new skills or get encouraged to eat some new foods. And so it's very important to show that no, actually patients are really engaged in these treatments, and that they if done right, they are not overwhelming.
And certainly it's helpful to have some teaching skills to teach people, shopping, meal planning, and some basic recipes to get started. And if the dietary intervention and the lifestyle intervention leads to reduced symptoms, people will sustain. And then if when they fall back on their previous eating and lifestyle pattern, their symptoms come back, now they're going to sustain that intervention. And that's what we've seen consistently in our trials. And we're in our ninth clinical trial now. Oh, actually, 12th clinical trial. And that is our consistent finding throughout all of these trials is as people implement, if they experience reduced symptoms, they can stay on the diet. If they don't experience reduced symptoms, people will drift back to their baseline usual diet. And my mentor, who's done many other dietary intervention studies, that is the consistent finding is that when you put people on a diet intervention, if they have reduced symptoms, they'll stay on the diet. If they don't have reduced symptoms, over time, they will eventually go back to their previous diet.
Tess, can you tell us a little bit about the Wahls Protocol and what it consists of?
Yeah, sure. So the Wahls Protocol is diet and stress reduction, toxin avoidance, exercise, sleep hygiene. So it's a whole lifestyle program. The Wahls diet is sort of a phased approach to steadily improve your diet. We have multiple levels. The first level, I invite people to go gluten and dairy, and also egg free, because those are the three most common foods that cause an abnormal immune response. And the foods to add are vegetables, the things that green leafy vegetables, deeply colored things, carrots, beets, oranges, and then the sulfur containing the cabbage family, onion family, mushroom family vegetables. And ideally, we're talking about 9 cups of vegetables a day because I don't want you to be hungry. And I want you to have sufficient protein. And depending on your gender and your workload, that may be 6 to 12 ounces of meat or beans and rice. And for most people, it is easier to do the adds than the subtraction. So I encourage everyone to start with the adds first, get all those vegetables in first, get your protein in.
Lots of us like vegetables, but don't eat enough of them. Lots of us, get into that rut where we got a couple of vegetables. So this idea that we see out here of trying to get, maybe as Tim Spector says, more than 30 different plants a week, where you're getting, a lot of interesting benefits from that diversity, a mix of phytonutrients, plant-based nutrients. You're getting a mix of vitamins and minerals. You're getting a mix of amino acids, right? When we combine different plants, we end up creating complete proteins. So, but Terry, people struggle to eat plants. How do you and your clinical team really help folks get up to that, 9 to 12 cups of vegetables a day?
Well, one of the things that we have to do is help them find ways to make them taste good. And when we went low fat and took the fat away, the vegetables become bitter. If you have vegetables with fat, that decreases the bitterness. And then if they're still a bit bitter, you can add some acid in the form of a citrus or a vinegar to bring the pH down a little bit, and that'll take care of the bitterness. A recipe a basic recipe that we use with our vets, we had to make sure that they ate bacon. If they ate bacon, then we'd have a little cooking class. So if everyone ate bacon, we'd fry bacon to the desired level of doneness, take it out of the skillet, chop it up, set it aside, take your vegetables. And a great exercise would be we'd take kale, pass it around, we'd all chew the kale, realize it was too bitter, terrible, you're never going to eat it. Your kids would never eat it. We agreed. Terrible. Now we fry up the bacon, chop it up, set it aside. We leave the bacon fat in the skillet, take the chopped kale that is too bitter to eat, put it in the skillet until it wilts. That's about 90 seconds. Put the chopped bacon on top and pass it around. And they're like, wow, that's delicious. And so our response is, this is the basic vegetable recipe. If it's not delicious, double the bacon and try again. And the vets would come back and say, like, even the Brussels sprouts were pretty good that way, Doc. So if you teach people that fat removes the bitterness, and if there's a little bit bitterness, you can add a little lemon juice, lime juice, or a vinegar, and that'll take care of it.
Now, Terry, so many people have been promoting this idea that, oh no, that bitterness is that the plants are full of toxins and anti-nutrients that are going to leach.
So let's talk about that. So
yeah,
plants are full of toxins. I completely agree. So plants are full of toxins. The medicines that you and I use, it's the dose that determines, is that medicine good for us or poisonous?
Mm-hmm.
And water, even, the dose determines, is it good for us? Or if we don't get enough of it, we die from renal failure. If we get too much, you may remember taking care of people in ICU who had water intoxication. I certainly did. You might not have being a psych resident, but we all.
In psychiatry, this presented occasionally when people would have
psychogenic polydipsia.
Yeah, and they would drink, and so you drink so much water that you dilute the electrolytes, the minerals in your body, and
you could stroke out. So all these plant nutrients are toxic. However, if you have a wide diversity of plants, these plants, instead of being toxic, help my physiology work more efficiently, reduce my inflammation, improve my ability to detox. And so kale, I love kale. Kale is a really great compound. But if that's all I ate every day, eventually some of the alkaloids in the kale would become toxic. But if I eat kale today, spinach tomorrow, beet greens the next day, lettuce the next day, parsley onion salad the next day. Now I'm rotating through all my greens, and all of the wonderful nutrition greens are really, really good for me. And my carnivore friends who say, plants are terrible, eat only animals because of the lectins in plants. Well, they're ignoring the fact that there are lectins in animal products too.
I didn't know that.
Yeah. So there's plenty of lectins in milk, plenty of lectins in eggs, and there's lectins in animal proteins, which is why you can have food sensitivity reactions to specific fish, shellfish, or various meats. So there is no food group that guarantees that you won't be at risk of developing an abnormal immune response.
I've also just read things like most things like lectins, they dissipate when you cook food. That most of the lectin
you reduce
come
them
from.
So having cooked vegetables, you reduce the lectins, but you may not eliminate them.
I guess where I've just struggled with this argument in general is that I really haven't seen any signs of toxicity in patients who are plant forward. And that as you increase plants in people's diets, you tend to increase all kinds of things that
For
we
the
tend to
vast
like.
majority, having a wide variety of plants is tremendously good for us.
Is there a way to know if we're one of these people who is in the minority that we should actually, are there some people who are extra sensitive to plants?
There are some psychiatry colleagues who are very um, promote a ketogenic diet, lower in carbs, more ketogenic, and use that as their primary treatment intervention, which has been successful. I've come to realize that there may be some folks who may benefit from a carnivore diet. I don't personally have any clinical experience
No,
with a
no, I
carnivore
don't think
diet.
there's any evidence for carnivore yet, Terry. I think that there's some minimal emerging evidence. See, randomized trials are kind of where it's at. We have one single arm trial which had, I think it was 16 patients with bipolar disorder and 5 patients with schizophrenia completed by
Yes,
Shabani Sethi this year. And so that was a very remarkable trial. It was single arm. And so, it really doesn't tell us a lot about determining this is really a treatment that truly beats placebo, in part because patients had so much help. They had weekly coaching, they had a lot of encouragement. There's a lot of excitement around, mitochondria and ketogenic diets. Um, uh, but in terms of specific carnivore, I don't think there's really been any
there's
trials
no
specifically on
research.
that.
There are no case
Yeah.
studies, no case series. In my conversations with my colleagues that do carnivore diet, I've been asking them to publish a case report, a case series, so we know how to evaluate and how to use this. I'm willing to entertain that there are a few societies that are carnivore that have been successful, that there are some practitioners that are using this, that there may be a role. I don't know what it is, but I think it's interesting. For what I look from an evolutionary standpoint, the vast majority of our societies are more plant forward. That we have a moderate amount of protein, usually meat, fish, and we have 200 plus plant species that we consume in the year. And so that's what I feel most comfortable recommending to folks. In that I think it's intriguing to think about the um, ketogenic diet, and we will certainly recommend. So my preference is people start with a paleo diet. If they don't do well, we do a paleo elimination diet, take out the nightshades. Then we also consider, should we talk about a ketogenic diet, particularly in people who have evidence of insulin resistance, metabolic syndrome? They're going to benefit from a ketogenic diet.
Is there a way that
And
people should understand insulin resistance better as a principle and something that they should evaluate when they're thinking about health metrics?
we have, I think, more than 100 million Americans, probably 1 in 3, who have insulin resistance and have multiple risk factors for metabolic syndrome. And unfortunately, your physician is probably not checking or thinking about this. So we can check for it pretty easily, thinking about your recent blood pressure, look at your lipids, are your triglycerides elevated, is your good cholesterol, HDL cholesterol low, is your belly bigger than your butt?
And these are kind of, in some ways, sound like classic signs of metabolic syndrome, that there's this metabolic dysfunction going on for people. Um, and I feel like sometimes there's a kind of confusion, right? There's a big push towards more plant based or entirely plant based vegan diets as a way to decrease fat, decrease caloric intake. A little bit of data, not much, that can help. And then there's this, kind of other camp, right? The ketogenic camp saying, no carbs or less than 60 grams. Is there a way that people listening can understand a little better whether they should,
Well,
it, which camp to move towards?
in I'll tell you, think where you're at in your diet. If you're this standard American diet, going to a Mediterranean diet or a paleo diet would be my first choice. If spiritually you're committed to being a vegetarian or a vegan, yes, you can do that. Just be sure that someone's monitoring your B vitamin status, please.
And I also think sometimes, as you said, part of your motivation of being a vegetarian was that you grew up on a farm and you loved your animals.
Yeah, I mean that's how I got started. I didn't want to eat my friends.
Yeah, and I really think sometimes that isn't brought into the conversation, that that's just a valid opinion, and that how some people
And if
feel.
that's why someone is spiritually vegetarian or vegan, I'm not going to stop that.
Well, I also wonder sometimes, for sure. I've also talked to a number of individuals in that world where, for example, they eat clams. They don't think about clams in the same kind of terms or levels of consciousness that they do, let's say, a cow or a chicken. Any of us who grew up on a farm and raised chickens, I don't actually.
They're
I
pretty
just started
smart
because I have
animals.
kids eating chicken meat, but I
Yeah.
really didn't. I really haven't for about most of my life, adult life, eaten chicken. In part, I just feel it's a great deal, the eggs, and I really just adore chickens. I like being out in the a barnyard with them. I like talking to them about all of the various, or not talking to my chickens about the various challenges that I'm having. Um, I like thinking about um, all of the functions they serve on a farm, whether it's fertilizing the soil or the idea that they produce an egg a day, or the amount of pests that they reduce. I mean, it's just, as you spend more time on a farm, conversations about meat consumption, animals' roles, in our lives, they get really, really nuanced. It's not just as simple as like meat or no meat. So I really appreciate you sharing some of your experience, being a vegetarian.
So my point for your listeners is you pick a diet where you'd like to start, whether it is a nutrient dense vegan vegetarian, Mediterranean, or paleo, and implement that and see how you feel. And for many, many, many of our vets, they felt great, and we had a remarkable improvement of their health, and that's where they stayed. And then we could see that they still, and I saw people lose 80 pounds and resolve their metabolic syndrome on the paleo diet. And I had folks come in, and they were really wanting to try the ketogenic diet because they knew they had type 2 diabetes. And I'm like, okay, we can start there. So part of it has to do with patient preference. Otherwise, I encourage people to start with a Mediterranean or a paleo diet. My preference is paleo, but Mediterranean is okay, and see what effect it has on your health. If you are type 2 diabetic, severe obesity, metabolic syndrome, there certainly is good evidence that both paleo and keto diets are very effective. If you do a keto diet, you're going to have to be very closely followed by your primary care physician to see what effect it's having on your lipids, your medication use. And actually, even if you're doing the paleo diet, I want you to be closely followed because any medications that you're on, the dose will probably need to be adjusted as your health improves and your physiology improves. But it's really a disaster to do a ketogenic diet on your own.
Well, and I think everyone listening, I hope you appreciate part of where I wanted Cherry to join us is I feel that she blends the conventional medicine, as we've heard, for her MS, she took a very conventional evidence-based approach initially, hoping for help, and didn't get as much as, and so blending these two worlds is where so many patients are, whether you're going to call it lifestyle medicine or functional medicine or integrative medicine, things that aren't a pill or a surgery or a device. Although conventional medicine, I think, is doing, many institutions are doing a better job encouraging. I mean, even in the WHO, evidence-based protocols for depression, food, nutrition, lifestyle are in there, and so there's more of that than ever.
And it's hard for your conventional doc to do much of this because they have only a few minutes with you. They're going to have to manage any prescription drugs that you're on. And so we also know that if they tell you, why don't you do a Mediterranean or a paleo diet? And they tell you that only 25% of the patients they tell to try a Mediterranean or some diet will make any change, and of those 25%, only 10% will actually still be sustaining that change at 2 years. Most people need more help, more support with a health coach or, working with a nutrition expert in order to sustain whatever diet that they themselves have said, "Yep, I want to implement."
It's a really important to note, as we've mentioned on the podcast and really been talking about ketogenic diets in regard to the single arm trial that came out with Shabani Setty's group, is to see that those individuals had remarkable improvements in their metabolic syndrome. I mean, it just really was astounding. They also had a lot of help and support. So the participants were really able to adopt these principles. We see a similar thing in the SMILES trial, which was Mediterranean diet for depression, or in the AMEND trial, which was a trial for young men with depression. That the attentiveness, the being seen, encouraged, supported, recipes, meal plans, more than just a healthcare provider saying you need a ketogenic diet.
Yeah.
That doesn't work. That's not healthcare. That's
It's not enough. And in our clinical trials, we do that too. We give people, recipes, meal plans, and, RD support, and group calls.
Are there certain pieces of that you think those of us wanting to make changes in our own lives should really implement? Should we join a group, or should we, get into work with a food coach or something like that? Is there a particular kind of, I don't know, secret sauce to your interventions of change?
A support group, very, very helpful. To have peers that you can interact with, very, very helpful. And then growing your skills, whether that is taking a cooking class, you can do it online, kitchen stores, local, your local Y or um, community college will have a variety of cooking skills. Local restaurants have a variety of cooking classes that can be very, very helpful. And then, some cookbooks can help get you exposed to more recipes, or cooking apps to help get exposed to more recipes. So growing your skills, and getting skills on learning how to shop, how to meal plan so you aren't wasting the groceries, that will help you. And, it's a journey. If you can find someone to go on this journey with you, a friend, a family member, that will make it easier. You could decide that as a family, you and your young children are going to work on developing these skills, shopping, meal planning, recipe skills together. That makes it a whole lot more fun. If you have a friend, a colleague that you want to go on this skill development journey with, that makes it a lot more fun. If there are peers with your mental health challenge that you could go be part of, that will make it more fun. I've done things with NAMI for little cooking demonstrations for them. That's been a fun thing. So there are a whole number of ways that you can get more support so you can be more successful.
There's one of the reasons we started the Mental Fitness Kitchen, which is our community cooking class that we do every quarter for free. And it's just been wonderful. Sometimes we have hundreds of people from around the country, other parts of the world, beaming in. Some cook along with us, but it's always so much fun, and it just gives me such a nice
Oh, that is
feeling of
perfect.
community and of connecting, and just wonderful, wonderful tips. Terry, you're talking about your relationship, and it just strikes me that you're a physician. I think you spent most of your life in Iowa, and so we have this, Midwest resonance between us. I feel, and you also have a wife. And I've never talked to you or asked you about your relationship, but it to me it feels very in line with you, that you feel that you have a set of values you've been very clear about, and then somehow transcended, or are transcending, the various challenges and discrimination that happen, being a gay woman in the Midwest. Would you share a little bit about your relationship, especially for any listeners who, I think, are having questions about how do you have such a content, successful, grounded life?
So I grew up in the 50s and 60s At that point, being gay, it was a pretty terrible message that I got growing up. Went to medical school hiding, uh, residency hiding, and then finally came to terms with being a little more public about who I am, and realized that it was okay to talk about my life. Because I had just gone through a messy breakup, and I was sort of laughing and joking about that with my staff, and it's like it was okay. The problem was that I had to be okay with who I am in my public life. Now, and then ultimately, Jack and I found each other. And at that point, I had my son, and my daughter was 18 months, and um, then I ended up, coming to Iowa, and having to come to terms with being progressively more disabled, and thinking about what it means to be a partner and a parent as I was progressively more disabled, and feeling like, okay, I have to be doing what I can, which was, getting to be less and less. And I think about Jack. Jackie was really quite remarkable. She would take me to the plant store to help her pick out the flowers that we're going to plant, then help me lay out a blanket, and I would lay in the grass. And she would ask where to put the plants to help her design where the flowers should go. And we were our kids were in children's theater, and she knew that I had a theater background, so I was helping the kids memorize their lines, and I was, volunteering in my limited capacity with the children's theater. So she was very active with making sure that I was staying active and contributing to the community and to family life. And one of the things that I recall is that Jack started taking me to the women's basketball games. Now, mind you, when I was, in college, I never went to any sporting events because it was not my thing. I wanted to be the athlete doing the stuff. I wasn't really into watching sports. So that was the first time I'd gone to a collegiate athletic event, but I had lots of fun. And so when I started walking, she said, "Let's get season tickets." So we started getting season tickets, and we've been going to those games ever since. But the reason I'm telling you all of this is Jack kept me engaged in life when there was another party that wanted to retreat. And the least I could do would be to stay engaged. He's putting in all that effort. I needed to stay positive and like, yep, I'm going to have a good time. If you're doing all this work, I'm going to have a good time with the garden. I'm going to have a good time. She took me when she'd go mountain biking and set up the blanket, and I would sit under the tree and wave to her as she goes out and comes back. And like, okay, I'll do my part. I'll have a good time, even if I still don't necessarily feel like it in my heart. I'm gonna choose to have a good time.
Oh, Terry, thank you so much. That's such a beautiful example of how relationships work. It's unlike other things where maybe a commodification, you give me this much, I'm going to give you that much back. It's more of this kind of flow, passing things back and forth between one another, little gifts, come help me plant, engage with our children, reminding you love the theater, reminding you of the things that you love about life in the midst of having so many challenges.
You can still contribute. That, yep, you can't walk around, but you can still help the kids memorize their lines.
How do people handle that in their lives when someone that they love is struggling with a disability? And I think so many people worry about maybe addressing it directly, or worrying that they're being patronizing or even infantilizing. How did Jack get that right with you?
It was well, these are the things that we can do. And so she'd be like, well, I'm going to go mountain biking and I think you should come along. And I'd say, well, I can't really walk. So, I'll get you to the chair. I'll get you to the tree, lay out the blanket. You can wait there. And we had a little folding, camp chair. So I could sort of sit on that. She said, I'll get you all situated. And so like, okay. And I mean, I was pretty committed that if she was doing the work, then I could at least do the work of I'm going to choose to have a good time. And, I was mindful that she was doing a whole lot of work to keep me engaged in living. So I needed to do my part of staying engaged as well. And, I think about the elements of, positive psychology, the good life, see the pleasant life, good life, meaningful life. So she was getting me out to the good life, it reminding me that there are, I enjoyed being outside, so she could get me out the park. That could be really very enjoyable. And then the meaningful life, like, Terry, you really like theater, the children's theater, our kids are in it. You could help those kids memorize their lines. You could sort of do a little coaching on how to deliver their lines and sort of help out. Like, well, okay, I could do that. And finding ways to give back, yes, to your family, that was good. Helping my own kids memorize their lines, but helping the whole theater, other kids, that's really very meaningful, and that was actually super, super fun.
Yeah, when we talk about building community or having community, how important community is. These little basic steps, I think, are very elusive sometimes until they're right in front of you. I felt that when I was my wife had me made sure I put in my schedule to coach our son's basketball league. He's in fourth grade. I'd helped out the year prior a little bit. I remember walking in this year, and all these little young men, little boys, they're a little taller. Their ball handling skills are a little better. They're more engaged. And it was just such a unique feeling of community. I was aware that I'm going to watch these young men or the young boys grow into young men. I was aware that some of these memories, these skills, the drills, whatever we're doing together, my enthusiasm, maybe that's going to stick in there a little bit and maybe help them in some way. And it's such uh, I guess I'm trying to illustrate for everyone listening something that I'm sure you know, which is that engagement in these little ways within your community has such big rewards. I remember
It is
after coaching a little
huge.
bit, I got asked, "Would you mind the scoreboard?" And I'm a little distracted with it. It's really hard for me, but I felt, oh boy, I just felt like a champ. Like I'm the dad that gets to run the scoreboard. This is wow. Who am I? So um, yeah, if you have a partner struggling, it can be challenging to make these concrete recommendations to, as we say, help someone mobilize, not just physically, but kind of emotionally, get out there, get engaged, get connected. But it's so important.
And you figure out something that they enjoy, and that, yeah, you may have to modify what they can do, because of their physical limitations. But if you can find some way for them to interact with this greater community, very helpful. And there are things they can do even in your household where they can still contribute. Like Jack having me help her figure out where to put the plants in the yard, in the garden. Super fun. Helping my kids memorize their lines. I'm laying in bed, and we had that was super fun. And then going to help other kids memorize their lines, that was pretty fun. And going to help them put on little makeup.
How do you? I mean, you're so committed to fun, which is I just love this about you. And I wonder, people don't value play, especially in medicine, and we've got serious illnesses like MS and depression. Fun play. It's like, well, it's not serious enough. how have you intuitively understand, experientially understood, and I guess most important for all of us, how do you hang on to play as a fundamental value?
Well, if we don't enjoy the activity, most most of the times the activity disappears. So I think I've understood that if you don't enjoy it, you're not going to keep doing that activity. So I fortunately have had the wisdom to find things like, okay, so what is the stuff that I enjoy doing, and then I play with it. With my kids, we can laugh and be silly about it, and Jack and I will laugh and be silly, and my kids talk about hearing Jack's cackling laugh, and you know Jack laughs perhaps more vigorously than I do spontaneously. Sometimes I'll laugh, then I say, okay, I have to amp up my laughter into a more vigorous ho ho ho.
Maybe that you really sometimes are aware there's some part of you kind of turning down the joyful feeling, and you're going to lean into it. You're
No,
gonna
I'm
you're
gonna
gonna
like, okay, if I'm not laughing enough, I will just intentionally, go ho ho ho. I will intentionally take it over the top so I can get that bigger, full belly, gut, raucous laughter going, and then my family will at times come running into my office like, "Are you okay?"
like I'm just up in the ante for playfulness and feeling great in this room. I'm great. Terry, what a joy to speak with you. I'm wondering about mental health role models. As I've been getting older, I've been thinking a lot about role models, both what I want to model for my kids and for our community, but also the people that I look to who maybe handling parenthood particularly well, or handling their mood, or how they communicate particularly well. Are there role models for you in how you handle your mental health and your mental fitness?
Hmm. One of the things that I think a lot about are the Stoics and the Marcus Aurelius. That the message I see there is if you master your inner life, you're going to be happy and joyful and content regardless of your circumstances, because you realize that these are all internal decisions because we take our circumstances and we choose our response, and that has really resonated with me that shit happens. We all are going to lose stuff, um, not get the job that we wanted, not get the promotion that we wanted. People that we love will have a terrible illness. People that we love will die, and we have to find a way to go on in spite of these losses, because we never mind all the wonderful things that happen, the promotions that we got, the new births that we got, the handsome man that we got, the beautiful wife that we got.
Or
We're
handsome
happy
woman, right?
about that.
And grandchildren. I'm sorry,
The grandchildren,
I
yeah,
didn't emphasize this in your bio. Is Grandma Terry
yeah,
Walls that
grandma.
we're
We got
talking
to get
to?
that those wonderful events, and but we also have to learn how to the fact that in addition to all these wonderful events will be these painful events that we'll have to find a way to accept and still move on and still find joy and meaning in our lives.
I love that you combine this notion so quickly in this podcast here at the end, but these two concepts of both playfulness, like a hedonistic yelp joyfulness, so much you're going to laugh out loud at times to up the ante when you feel a diminution in how joyful you're feeling, and couple that right away with stoicism. This idea that actually we're going to tolerate, we're going to endure, we're going to sit with our feelings, we're going to master our internal life. And I just, I really appreciate that. I hope everyone
Both are part of my life, and they'll be part of all of your lives. We have these wonderful things to be so happy for, And then we have loss that we'll have to figure out how we can cope. And it may be that at the same time I have that loss, I'm going to lean back into the parts of my life that I can still find great joy and that I can still laugh.
It's quite helpful for me personally, I think, because I often think about these as disparate parts of my character. I can be very silly and creative, and like you, I have a history in the theater, and I adore that playfulness, and and then I feel I have to be very serious. I'm a physician. People are talking to me about very, critical and serious, often unknown things about themselves. And it's easy for us, I think, all to feel like, well, it's kind of either or. And I really appreciate, you modeling for us this notion that one, the reason these two things are in your life is because they work for you, and it's very palpable. But also that they easily can be combined. They're not as disparate as maybe I think that I can, and all of us can have both these more disciplined elements and at the same time have this spontaneous, creative, associative, fun feeling, and really, yeah, that's very helpful for me. I hope everyone listening that is sitting with you. Terry, thank you so much. I'm wondering if you can leave us with something. I hope that these episodes, especially for everybody who's been a hero and stuck with us and is a mental health hero in my mind, something to kind of direct us in the next few days, something that's maybe in your life with your mental fitness right now that's intrigued you. But can you share with us, I guess, a little tip, a Terry Wahls tip for caring for our mental fitness in the coming days?
Get outside, sit on your porch, take a walk, but be out in the daylight. I do within the first 2 hours of the day. Even if all you do is just stand out for a minute or two, to be very helpful. Look up at the sky, close your eyes, face the sun, get that daylight onto your face, onto your retina through closed eyes. That will help reset your circadian rhythm. That'll be very helpful. And then the other thing I would say is follow me on Instagram so you can see what I'm eating and doing and the fun I'm having.
For sure that, and also, you've shared with us some other just wonderful tips, whether it's a real positive affirmation, I'm going to be victorious, a real expansive stance you get into. And then I really appreciate your sharing this active gratitude this way. Can you tell just a little again around at the end of the day, as you're winding down, you're getting into bed, you have this very visual act of gratitude practice?
So as I go to bed, I'll do 4 to 8 cycles of 4-7-8 breath work. Inhale to the count of 4, hold to the count of 7, exhale slowly to the count of 8. Then I go through some period of my life and I'm visualizing the person and I'm thanking them, or I might be visualizing my farm, the stream on my farm, the trees on our farm, and I'm thanking them. And that's what I'm falling to sleep to is these gratitude thoughts.
I really appreciate that also with some things maybe in your past. I sometimes struggle very much with missing my farm or missing my
Mm.
horse or not being kind of immersed in nature as I have been in some periods of my life. But I just, before this, I was looking at some pictures of our son with my mom when everyone was like kind of younger and on the farm and in that, really joyful, creative space. And I think it's really wonderful for us to maybe not sit in the loss or the missing, but to really embrace Terry's guidance around sitting in the gratitude, the act of gratitude. We talk a lot about that in the episode on Meet SETI, our friend and integration physician, integrative physician, really talks about this, much more active sense of gratitude, even gratitude for some of the struggles and the challenges. So thank you for that, Terry. I really appreciate all of your thoughts and your tips. Everybody give Terry a follow. Please, especially if you're struggling with chronic illness or an autoimmune component to your mental health challenges, please check out her information, her Wahls protocol, and then also her research. We talked to a lot of different experts on here, but the individuals who are this combination of seeing patients, really walking the talk, and as Terry's been helping our veterans, the VA throughout her career, and then also doing research, really testing these things out and understanding, the difference between, a case report or some excitement about a mechanism and the real reality of what, according to the evidence, can best help us in our journeys. Dr. Terry Wahls, what an absolute treat to know you, to be on this journey with you. I look forward to speaking to you in the future. I can't wait to see you next. And thank you so much for joining us. Everybody, as usual, please take these thoughts, these ideas, whatever resonated with you, and actualize it. I really ask you to do something with these episodes. So with each of them, we're all doing something to improve our mental health and improve our mental fitness and really control the narrative of our lives. I'll see you all soon. Thanks so much. Please share these episodes. They're up everywhere, and take care.